Good morning. I'm Dr. Sloan Manning. I'm a family physician here in Winston-Salem, North Carolina. I'm an adjunct professor in the Department of Family Medicine at the University of North Carolina. I co-direct the Mood Disorder Clinic at the Cone Family Medicine Residency in Greensboro, North Carolina. I am the primary care psych section editor for PsychU. And I'm here today with a patient that I think we've known each other about 10 years, Lesa.
Yes.
Lesa is here, and we're going to talk today about major depressive disorder and the journey that it is, and what's involved in getting well and staying well. So, Lesa, thanks so much for being willing to share your story today. This is something that people can be a little hesitant or reticent to do. You and I have known each other about 10 years. Can you remember what was going on the day we first met each other 10 years ago? I bet you can.
I do. I was at work and I developed a migraine. It was so bad that I thought, I can't stay here. So I left work and came to your office. You were available, and so I saw you that day for the first time with a migraine.
Okay. So how did we get to the anxious or depressive part of the interview? How did that go that first day? Did you mention some symptom that kind of triggered a question? How did that happen?
Not at all. Not then. And you were my doctor for years after that, treating just the regular symptom, the sinus infections, the sore throats, and all those things. And I think it was about 5 years later that after you had been my doctor, that I came in with, the symptoms were that I ached all over, and I just had no energy. I just felt bad all the time. And I think I'd seen an ad on TV that said that depression hurts. And I thought, everything hurts, but it's not like a sore throat, it's not a headache, it's my muscles ache, I can't sleep at night, I lay down and my thoughts race to everything that's going on in my life. And so I came into you and said, I need some help.
So you had bodily pain, you had insomnia, you had the sense that things weren't right. We obviously had a conversation. Do you remember experiencing sad or depressed mood during that time?
I was sad. I had a lot going on in my life. My husband was very ill, and terminally ill as it turned out. And I had a lot of things going on, and I think the main thing was, besides the body pain, was I just felt like anything that happened was the straw that broke the camel's back, that I just couldn't handle one more thing. Everything was too much.
Just overwhelmed.
I was totally and completely overwhelmed. So I came into you with no real symptoms like I need an antibiotic but everything hurt. Like I said, I couldn't sleep. I felt terrible all over. I was exhausted.
Do you remember me giving you a piece of paper to sort of check on symptoms? Do you remember that?
I do. You very calmly said, well, let's take a little test here and see. And it was just simple questions, and every one of them was, well, that's me. That's exactly what's happening to me. With the insomnia and the pain and I'm not a grumpy person normally, but I felt like I was on my last nerve, and I snapped at people that I would never, ever be angry with. And every question that was on that sheet of paper was me. Yeah. And after you came in and examined it, you told me that there were medications available that could make a difference.
What Lesa's describing is the administration of the Patient Health Questionnaire 9-question version, and she didn't mention specifically the GAD-7 for Generalized Anxiety Disorder symptoms. And as I recall, she had a pretty thorough endorsement of multiple anxiety and depression symptoms. She met the criteria for a major depressive disorder. She also met what would be now known as the DSM-5 sort of anxious distress specifier. And she was feeling very, very bad. So we had a conversation about your symptoms and put it in the context of an illness that could be treated. And tell me what you remember next.
Well, I remember thinking, and I'm not proud of this at the time, that only a weak-minded person couldn't get a grip on themselves and get through the things that life throws at you without medication. And I believe I said those words to you, that I don't want to be a zombie. And you said, well, we'll start out at a very low dose and see if this helps, see if it makes a difference. And it made some difference. I took it for a couple of weeks and came back. We gradually increased the dosage till I realized I don't feel like a zombie at all, never did. But now I'm not snapping at people. I sleep at night. I lay down and everything that I could have said, should have said, would have said, everything that I've ever done wrong in my life doesn't race through my thoughts. I lay down, I sleep, I don't hurt all over. But I feel like me. I felt like me again. I felt normal and not.
Yeah. Now you and I'm pretty sure, because it's my standard practice, and I kind of have a memory that we actually did this. You were going through some very difficult times. Your husband was very ill at the time of the chronic illness, being seen at one of the tertiary care universities here in North Carolina. We had a conversation about how being overwhelmed and being sad or normally sad or confused or anxious or normally confused and anxious was something different than having a full-blown depressive disorder. It looked like to me that you had probably inherited, because there were some members in your family with similar illnesses.
Yes.
You'd inherited a tendency toward anxiety and depression, and your husband's illness had triggered or pushed you into sort of a full-blown event. Do you remember a conversation like that?
Absolutely. Okay. And you also suggested a counselor, that besides the medication, seeing the counselor for a year, for about 6 months before my husband passed away and 6 months after, it made a huge difference to go and speak to someone about the feelings, and she was very helpful in dealing with it.
Your therapist is one of my favorite therapists of all time. She's wonderful and terrific. So as I recall, you were on the medicine. We did gradually increase the dose. You felt back to normal. Your husband, unfortunately, did not survive the illness.
Right.
So you moved into a very, very different phase of life, and psychotherapy or talk therapy helped kind of process that. You stayed on the medicine a while, and then you decided, I think I want to go off the medicine. Tell me about that.
I decided that I had worked, certainly I wasn't completely through the grief, but after working with a counselor for a year and being on the medication for a little more than a year, we had a conversation, and you said that sometimes people I backed off of it slowly and reduced the dosage, and I did very well. I felt like I was doing quite well without any medication, and that went for about another year. And the next year, I was feeling better. I wasn't having the symptoms of depression or anxiety, and then I found I developed breast cancer, and that was a very difficult stage as well. That required a couple of surgeries, and after that event, I realized I was spiraling again. It was completely out of my control. So I came back and said, Dr. Manning, I'm feeling this again. And again, you gave me the papers, and I went through, and oh yes, it's back. When I had stopped taking the antidepressants more than a year before, when I would take the test, the symptoms had abated completely. I felt like, I don't know if remission is the word.
It's exactly the word we use.
And but I felt great. But after the cancer ordeal, for whatever reason, it triggered a return of the anxiety, the depression, and I came back to you.
Yeah. call that a reoccurrence of illness. And again, in the current sort of stress diathesis model that I sort of work with in my own mind about this, the vulnerability toward these illnesses is typically inherited but can be developed or acquired, and you can have obviously combinations of inherited tendencies and acquired vulnerabilities depending on what your life history is. But it's the stressor is often the timer of the full-blown episode. And Lesa had a pattern that was pretty clear that she could live after having a robust, sustained remission. She could go off the medicine. She would do very well, but a significant stressor would be a timer for a next event. And your breast cancer was the next event.
Yes.
So back on medicine, and how long did you take medicine that next time? Do you remember?
I'm still continuing to take it.
So I want to talk about that because you made a decision about staying with the medicine, and you've been on an antidepressant for how long now?
Since 2016.
Okay, so we're now 2 years into trip number 2. And why have you stayed on it so long?
You and I had a discussion about it, that I could decide to stop taking it again since I'm feeling well, or I could continue to take it basically as a maintenance medication so that I could continue on. It doesn't make me feel weird. I'm not a zombie. The only thing the medication does is make me feel normal. That every event that happens isn't a crisis, that I don't have to panic over if the dog is limping. It is not a crisis. I will take her to the vet tomorrow and it'll be fine. It makes life, it makes it easy to deal with each situation in life that comes along. And the medication is inexpensive, and that's not even really a factor. The difference it made in my life, you can't put a price on that.
So 2 years on maintenance, and again, your language is really good. You've done some reading, or maybe I did a better than usual job of explaining things. I don't know, but you're in maintenance therapy, and again, the maintenance therapy is essentially therapy to prevent another episode. So if you think in terms of risk, after you've had one episode of major depressive disorder, the risk in a lifetime of having a second is about 50-50. After 2 episodes, the risk of having a third is about 70-30. And after 4 episodes, your risk of having another episode is about 90-10. So the idea was, if we have established a pattern where we know we're vulnerable and the medicine works and is well tolerated, and we don't want to go there again, then we can choose to take the medicine as a preventative, which is what you chose.
Exactly what I'm doing.
Does the medicine bother you at all?
Not at all. I wouldn't even know. I just take it after dinner every night. It doesn't make me feel anything but normal. It doesn't bother me. There are no side effects at all. I just continue to feel good and enjoy life.
Now it's interesting because the antidepressant you're on now and have done well with maintenance is not the first antidepressant we chose.
It is not.
They both worked well, but your son had a particularly good response, I think, to the medicine you're taking now.
Yes.
And since responses often run in families, and he did really well on this particular antidepressant medication.
Correct.
You asked, and it seemed very reasonable to use that medicine for you, and it's worked out very well. So we used your family history a bit in the selection of the medicine, although the other medicine had worked just fine as well. You wanted, and had a little more confidence, I think, based on your son's experience, that this might be the medicine you'd like to choose for that next episode after the breast cancer, and you stayed with it.
And oddly enough, the first medication that worked so well while my husband was ill, when you prescribed it again after the cancer ordeal, it made me nauseous. I mean, nauseous to the point that I couldn't function. Where the first year or so I took it, had no difficulties with it. So I came back and said, oh, I can't. It was very, very difficult for hours afterwards. I was extremely nauseous. So changed the medication, and I understand there's several different kinds out there. It isn't, if one doesn't work, you can move to something else.
Exactly.
And it worked wonderfully for me.
Yeah. And it's not that unusual that the first episode you treat, the medicine might, not be as tolerable for reasons we don't entirely understand. So being flexible is great because the toolkit has a number of members. The medication that you first took and now take are in the same class of antidepressant medications, and it was just reasonable to do something that your family or a person in your family had responded to. Now, I'd like to know, because I know a little about you, how you have communicated this experience to other people. There's a depression, anxiety stigma out there. People don't talk about this that much. Sometimes they're ashamed. I mean, I've seen people who have been, very willing and happy and open about these kinds of things. But I think most people are like, not just saying, yeah, I'm on an antidepressant and I feel great. How do you communicate? If you take the medicine, why you take the medicine? Do you support anyone who is, now being treated for anxiety or depression? How has your life and interactions with others been changed by the experience?
Well, truthfully, you're exactly right. I put the same stigma on mental illness, just the sound of the word. And it reminds me of when I was a little girl and someone in the family had cancer. No one would say the word cancer out loud. They would say, did you know Aunt Merle has cancer? And they would whisper it like it was something you didn't talk about in
We used to call it the C word.
Right. You didn't even want to say cancer.
That's right.
Well, mental illness is the same way. And I, too, when I came to you and you suggested an antidepressant, my first thought was, I'm not weak-minded. I'm a strong person, and strong people don't need medication. They need to get a grip on themselves. And I realized that I had prayed and asked God to help me get through it. And I had tried to be strong. And then I finally realized that sometimes you have to, as with cancer, you have to, if you're a person of faith, let God work through your physician and use what's available to the physician to treat you. And just now, as a matter of fact, one of my oldest and best friends had breast cancer 5 months before I did, the exact same cancer. And after her ordeal, she too developed depression. And she didn't want to talk about it to anybody. And she and I were at lunch one day, and she said, do you have any trouble sleeping since you had the surgery? And I said, I did. And she said, but yours got better? And I said, not without help. And I explained to her that I had gone back to you and told you what my symptoms were, and that once again, there's the anxiety, the inability to sleep, there's so many things, the snapping at people. And she said, I do that. I snap at my children. And she said, I feel terrible. And so she too went to her doctor and explained. And she too. And I belong on Facebook to several groups of people that have, or exploring, they think they have anxiety disorders. And I enjoy, I guess enjoy is a bad word, but
it's okay to enjoy.
I hate that other people feel the same way. But when they come to the group and they say, well, I think I may have an anxiety disorder, and these are my symptoms, what do you people think? And then I'm able to say, in a nutshell, I went through some experiences that triggered it, and why don't you go talk to your doctor and see what he says or she says?
Such a beautiful story. I mean, it's become a story that you tell that ministers to others. I think that's a wonderful thing.
And I want to help other people understand that you can take these medications, and you hear people say psychotropic medications, and it sounds like a really scary thing. to me, it harkened back to the days of a shock therapy or something like that. And it absolutely isn't. It just balances a chemical in your brain that allows you to be yourself. It doesn't change you. It just makes you feel like yourself again.
I remember you telling me you didn't want to be a zombie.
Right.
And I told you, as I tell everybody who asks me that, I said I had no interest in zombie Lesa. I just wanted to see the real Lesa, which is exactly what happened.
And the person you were seeing then was not me. Not at all.
Yeah, not the person I'm talking to now. That's really cool.
Well, thank you. And thank you so much, because it has changed my life so much for the better.
Oh, you're most welcome. Well, Lesa, I just want to thank you again so much for being willing to share a story of a real experience and hope, and the hope you've been able to communicate to other people. It's beautiful, and I think it's going to help a lot of people who have an opportunity to see this on the primary care section at PsychU.
I just want people to understand that forget about the stigma, forget about the zombie, all the things you've ever heard, but go to your physician and just talk to them. And if you feel like you may be depressed, if you're feeling anxious, if you don't feel like yourself, it's so easy to get help. And your doctor will not stigmatize you. You were so good and so easy to talk to, and made it so easy to regain my health.
That's wonderful. It's been a pleasure. So I'm Dr. Sloan Manning, and this is PsychU and the primary care section, and we hope that this conversation will benefit many people.